coming to the next point, that is the muscle attachment, muscles and ligament attached to the hip bone in the iliac crest. So this is the iliac crest. It is its ventral segment. This one is its dorsal segment. Ventral segment has an outer lip, intermediate area, and inner lip. The outer lip gives attachment to the tensor fascial lata, iliotibial tract, external abdominal oblique muscle, latissimus dorsi. Intermediate area gives attachment to the internal abdominal oblique muscle, and the inner lip gives attachment to the transverse abdominis that arises from anterior two-third, and the quadratus lumborum arises from its posterior one-third. Coming to the dorsal, this is the dorsal segment of the iliac crest. It has an outer and inner sloping area. The outer sloping area gives origin to the gluteus maximus muscle, and the inner sloping area gives origin to the sacrospinalis. Coming to the prominence of a ilium and a pubis, this is the anterior superior iliac spine. See the diagram, you can see this is the anterior superior iliac spine. It gives attachment to the one muscle and one ligament, that is it gives attachment to the sartorius muscle and lateral end of the inguinal ligament. Then coming to the anterior inferior iliac spine, it gives origin to the one muscle, that is the origin to the straight head of rectus femoris muscle, and the one ligament, that is attachment to the iliofemoral ligament. Then coming to the anterior superior iliac spine gives attachment to the one muscle, that is a sartorius muscle, and lateral end of inguinal ligament. Coming to the anterior inferior iliac spine gives origin to the straight head of rectus femoris and the iliofemoral ligament. Coming to the iliopubic eminence, this is the iliopubic eminence. It gives insertion to the psoas minor muscle and attachment to the pubofemoral ligament. Then coming to the pubic tubercle, this is the pubic tubercle. It gives insertion to the cremasterate muscle and attachment to the medial end of the inguinal ligament. Lateral end of inguinal ligament is attached to the anterior superior iliac spine, and its medial end of inguinal ligament is attached to the pubic tubercle, like this. Then coming to the pubic crest, it gives origin to the rectus abdominis and pyramidalis muscle. Coming to the gluteal surface, so this is the gluteal surface. This one is the gluteal surface. Okay, this is the gluteus maximus, arises behind the posterior gluteal line. Gluteus medius arises between the middle and the posterior gluteal line, and the gluteus minimus, which arises between the middle and inferior gluteal line, and reflected head of rectus femoris arises from a groove above the acetabulum. Coming to the ischial spine, this is the ischial spine. Actually, this part is broken in this bone. See, in this diagram, see, this is the ischial spine. Gives attachment to the ischial spine gives attachment to the sacrotuberous ligament. Then coming to the ischial tuberosity. See, ischial tuberosity. This is ischial tuberosity. It gives lateral border gives attachment to the sacrotuberous ligament. Upper part of the quadrangular area gives attachment to the semimembranous. Lower medial part of quadrangular area gives attachment to the long head of biceps plus semitendinous. Then lower triangular area, this is the lower triangular area, gives origin to the ischial part of the adductor magnus. Medial part of the triangular area gives attachment to the fat tissues, and the medial border of ischial tuberosity gives origin to the quadratus femoris muscle. Then coming next, that is the pubic bone. See, this is the pubic bone, gives origin to the pectineus muscle, because see, this is the pubic bone. Actually, this is the arcuate line, and arcuate line continue further as a pectineal line. So it gives origin to the muscle, that is the pectineus muscle, and see, adductor longus, adductor brevis, and adductor magnus also arises gracilis muscle also arises, and obturator externus. Then muscles of the medial aspect of the hip bone, that is the iliacus muscle. This is the iliacus muscle attached over here. Then over here it is attached posterior interosseous and a sacroiliac ligament. Here it is attached sacrospinalis and a quadratus lumborum. Then here it is a coccygeus. See, in the ischial tuberosity is ischial spine. In ischial spine, here it is a coccygeus, sacrospinous ligament, levator and knee. And this one is the obturator internus. Then coming to the ligaments and membranes attached to the hip bones. So first is the sacrotuberous ligament attached to the medial border of the ischial tuberosity. Then next is the sacrospinous ligament that is attached to the tip of the ischial spine. Interosseous sacroiliac ligament attached to the ischial tuberosity, iliac tuberosity. Interosseous sacroiliac ligament is attached to the iliac tuberosity. Anterior sacroiliac ligament attached to the periauricular sulcus. Posterior sacroiliac ligament behind the iliac tuberosity, and inguinal ligament is attached between the anterior superior iliac spine laterally and pubic tubercle medially. Lacunar ligament and a pectineal ligament attached to the pectineal line of superior pubic ramus. Obturator membrane attached to the margins of the obturator foramen except in its anterior part. Then a perineal membrane is attached to the ischiopubic rami. Then iliofemoral ligament is attached to the anterior inferior iliac spine. Pubofemoral ligament is attached to the iliopubic eminence, and ischiofemoral ligament is attached between a groove below the acetabulum. Over here somewhere it is attached. Then coming to the next point, that is the articulations of the hip bone. The auricular surface of the hip bone articulates with the sacrum. It articulates with the sacrum like this, forming the sacroiliac joint. See, like this, or synovial joint. This is synovial joint. Then the acetabulum. This is the acetabulum, which articulates with the head of the femur. See, like this. This is how it articulates, forming a ball and socket synovial joint or hip joint. Then the symphysial surface of the pubis. See, symphysial surface of the pubis articulates with a fellow of opposite side like this. Symphysial surface forming the symphysis pubis of opposite side, that is a cartilaginous joint. Then coming to the diameters of the hip bone. See, actually straight diameter, there are three straight diameter conjugate, that is the anatomical conjugate, gynecological or obstetric true conjugate, and diagonal conjugate. Lesser pelvis is known as a pelvic outlet, also has a transverse diameter and a straight diameter. So, this is the pelvic minor, and this forms the upper area, forms pelvic major. So this is all about the hip bone. Do like this video, and if you want to refer my notes, you can even go on my Instagram account, that is anatomy1803. Thank you for watching this video.